CT scan, MRI, ultrasound, X-ray, kag mammogram. Pila lamang ini sa mga pirmi nato na batian gikan sa mga doktor kung magpa-check up kita. Pero ano bala ini? Kag para sa diin. Ini ang istoryahan ta sa sininga episode. Sa idalom sa Department of Imaging Sciences ng Riverside Medical Center, ang ini nga mga diagnostic services ang available. Sunod sa resident radiologist si Dr. Leopoldo Jose Maria Picasso, kada isa may kinaiya nga kinalain sa isa. May advantages kag disadvantages. Parehos na lang sa ultrasound. Ang ultrasound, isa ini ka imaging test nga nagagamit ng sound waves para makakuha sang pictures ng solid nga organs, tissues, kag iban pang structure sa sulod sang lawas. Pinaagi sini, makita sang doktor kung ano ang yara sa sulod sang aton nga lawas bisan wala sang surgery. Wala ini nagagamit sang radiation.
Pregnant women, we deal with pathologies with your abdomen. Usually, we deal with solid organs. Okay? So, for example, the liver is a solid organ, the spleen is a solid organ, your kidneys are solid organs, and they can be viewed very well by ultrasound. Okay? So, most of the time, these solid organs, of course, sometimes present with pathologies, and of course, the most common, of course, I suppose, in the liver is a fatty liver, no?
Kasi fatty liver, pabalaan mo siya through sa ultrasound.
Yes.
Kung how serious it is, kung ano siyang...
Yes, so usually, of course, a fatty liver, there are different pathologies for fatty liver, of course, diba? Usually, gastroenterologists will ask for that because, of course, usually your laboratory liver functions are high, for example, or your cholesterol is high. So they will actually ask for an ultrasound, no, to take a look at your liver.
May ara sang MRI o kunang magnetic resonance imaging. Usually, ginagamit ini sa pag-detect sang stroke. Ang MRI ang malawig-lawig nga proseso. Masulod ang pasyente sa machine sa sulod sa pila ka minutos o kun oras, depende sa kinahanglan. Ginatawag ini nga problem solver. Mas detalyado ang image nga sarang sini makuha.
The MRI is usually used to detect strokes. The most common, okay? Usually, it's used to detect strokes or bleeds in the brain, okay? That's why although there are limitations to MRI, the most common of which is number one, it takes a long time. It's not like CT scan. CT scan, you can do a CT scan in a minute, less than a minute. But MRIs will take much longer. For example, for the brain, it might take 45 minutes, it might take an hour, depending on the pathologies that are suspected, okay? There are different, what they call sequences. There are different sequences for different pathologies in MRI. That's why they call it really a problem solver. Yes, MRI really is a problem solver, and it really is an excellent imaging modality.
Sarang sini makuhaan sa pictures ang brain kag sa Riverside Medical Center, may cardio MRI man sila. Pati sa heart, pwede ini magamit. Kag pwede ini ma-avail 24/7. Basta may ara ka lang sa request gikan sa doktor, pwede ka maka-undergo sa MRI kag sarang makuha ang result within 24 hours.
Okay, ang RMRI is 1.5 Tesla. So, the result is within 24 hours, and also it is available 24/7. So, we have radiologic technologists available in that period of time. So, 24/7 na ang aton nga MRI.
So, any time of the day, pwede ko
Yes.
kung need ko ang MRI.
Yes. And if you have a request from your doctor, you'll just have to go to our reception para magpa-schedule and also through call, and then set an appointment with us because it depends on the procedure also.
Ang CT scan o computed tomography ang ginagamit sa emergency cases naman. Dasigay abi ang ini nga proseso. Sa mga na-involve sa vehicular accident, ini ang ginagamit ka imaging. Amuman sa mga fractures,
Usually emergency cases, all of your trauma cases, all the vehicular accidents that involve, hitting your head or falling, things like that.
It's way matter of speed.
Yes.
Importante siya.
Importante, especially since what you call a CT scan really does excellent work with bones. So you can see fractures much better in CT scans. Yes. So for example, patient underwent a vehicular accident, or maybe somebody mauled him, for example, whether he got hit by a bat or hit by a stone in the head.
So, kung naman CT scan naman ang ginapang kayo
More likely CT scan.
Sa Riverside, may bago nga machine. Mas madasig ang scanning time kag better ang quality sang image.
Our CT scan is new. It just operated this March 2024. It is a GE Healthcare Revolution Maxima 128 slice, reduced scanning time, reduced exposure of radiation. It is comprehensive diagnostic and versatility. Also, it is available 24/7, and you can book through call and through our reception. And then after that, our result for brain plane is within 4 hours, and for others is 12 hours.
May ginatawag naman nga mammogram. Ini ang ginagamit nga imaging sa pagdetect sang breast cancer. Mas maayo kung ang mga kababayan nga 40 and above ang edad nagapaidalom sa mammogram para ma-detect sang temprano pa kung mayara sila sang breast cancer.
Mammogram, since especially this coming October, breast cancer awareness. Yes, breast cancer is the most common cancer in the Philippines in women. So, mammogram is the best modality also in detecting early stage of cancer. So, it produces x-rays also.
Okay.
Tapos, gina-compress na siya ang breast through our machine.
Especially since breast cancer is so common now,
Yes.
it's very, very advantageous to screen it. So, of course, for women over 40 years old, it would be very advantageous if they start doing breast mammography, no? And of course, ultrasound. Okay, so nowadays, of course, that can be part of your PE, or usually, physical examination, especially for women who are over 40 or over 45. Yeah.
Kag, ang permit na mabatian, X-ray o kunang X-radiation, ini ang pinaka-common nga imaging. Ang chest X-ray, ang isa sa mga requirements sa pre-employment, pinaagi sini, may baluan kung may tuberculosis ang isa ka pasyente. Dili man makita ang fracture sa bones.
A lot of TB patients actually are symptomatic. And so, usually they would like to screen for TB. Of course naman, the usual ubo, any kind of cough for a certain amount of time, whether it's 5 days or 7 days. Doctors would like to investigate further, want to take a look if it's pneumonia. Of course, they'll recommend a chest x-ray. Aside from that, of course, x-rays, fractures. For the bones, of course.
Pinaka-basic na sa
Yes.
balian ka.
Yeah,
X-ray.
kung nabalian ka, whether, you fell on your hip, you fell on your arm, you fell on something, whether natapilok ka, diba? Usually, they'll take a look.
Sa Riverside, ang chest X-ray sarang makuha ang resulta in 2 hours. Kag sa iba naman nga klase sang X-ray in 12 hours. Buot silingon within the day, magwa ng imo nga resulta.
Ang chest x-ray is within 2 hours, and other x-rays is within 12 hours. Ma-release na siya ang result.
So within the day.
Within the day, makuha ta siya.
Sunod pa sa kay Dr. Picasso, wala sang dapat ikakulbaan ang mga pasyente kay paidalog sa sini nga mga imaging. Hindi ini pag i-recommend sa isa ka doktor kung hindi ini maayo sa lawas.
Generally speaking, okay, doctors weigh the risk versus the benefit. The benefit and the risk. So, for doctors, okay, when they prescribe you a certain modality, they're already thinking that the benefit of knowing the pathology is much higher than the risk.
Pinaagi sa sini nga mga imaging, mas matagaan sang klaro nga view ang aton nga mga doktor sang sitwasyon sang aton nga lawas. Kag sa October 1 to 4, Ancillary Week celebration sa Riverside Medical Center. Gani, may 15% discount sa tanan nila nga mga services.